The most confusing modifier is modifier 25. Modifier 25 can be appended to an evaluation management service. It's when evaluation management service is separate and identifiable from a procedure that's being done on the same day. So just understanding when it can be used and when it can't be used is really what's most important. And actually, that's the modifier which probably sets off the most red flags for insurers to do audits, because again, that's the one that I think most people are confused about. What we have to remember when doing procedures, any surgical procedure, whether it's something minor like a cystoscopy, whether it's an intramuscular injection, whether it's a intravesical installation of a chemotherapy or other medication, or a radical prostatectomy or major surgery, all of those procedures have a global period. And the global period includes associated evaluation management services done on the day of the procedure, unless there's something above and beyond that procedure. So, two examples would be one, if the decision for surgery is being made on the same day as a procedure. Let's say a urologist sees a patient in the emergency room and provides an evaluation and management service in the emergency room, but brings the patient to the operating room that day. Normally, that evaluation management service that's associated with the procedure would not be reimbursed. But modifier 25 is a communication to the insurance company that it is appropriate to separately bill the evaluation management service because you're evaluating managing the patient to determine their need to go to the operating room. Because if the patient was seen on one day, yet was not taking the operating room until the second day, the evaluation management service would have been paid. But if they're both being done on the same day, the same amount of work's being done. So that's one example of appropriate use of modifier 25. Another appropriate use for modifier 25 is when a procedure is being done, which leads to the need for a separate identifiable evaluation management service. So something that's completely unrelated to the reason for the procedure. Let's say we're doing a intramuscular injection for somebody with prostate cancer, which is a 0-day global, but we're also managing their kidney stones. That has nothing to do with the injection for the prostate cancer. So modifier 25 would be appropriate to use to so that your management of the patient's kidney stones, for example, is unrelated to the management of their prostate cancer with that intramuscular injection. Or let's say during a workup for somebody who has blood in the urine, a bladder tumor is found. We were doing the cystoscopy to evaluate the patient's blood in the urine. And now we found a bladder tumor, and now we have to have a separate discussion with the patient about this new finding to evaluate management, their new finding of their bladder tumor. Those are appropriate uses of modifier 25. Inappropriate use would be if, example, the patient who is seen for a procedure on day one comes in for day two for the procedure which has been scheduled, and somebody tries to report an evaluation management service on that day when it's already been determined the patient needs that procedure on that day. Or if the patient is getting a procedure and the follow-up discussion is all completely related to the reason for the patient getting the procedure on that day. That would be inappropriate use of modifier 25.